Alright folks, here we go with the top 10 video for chapter 4 on truth-telling and confidentiality. We've got 11 things that you should know from the chapter 4 overview. Number 11, what is confidentiality? Confidentiality is a concept that describes the idea that when patients give information to healthcare professionals, there's a duty of confidentiality. There's an understanding that patients have a right to privacy, and there's a promise, whether implicit or explicit, that the information that the patient gives will not be shared with others. In fact, this is part of the Hippocratic Oath. Whatever I see or hear, professionally or privately, which ought not to be divulged, I will keep secret and tell no one. So, a healthcare professional makes a promise, as a healthcare professional, not to divulge private information. The number 10 thing you should know about Chapter 4 is what moral standards conflict when issues of confidentiality arise. Issues of confidentiality arise when we have a conflict between, you guessed it, autonomy and beneficence. As you know, the principle of autonomy states that we should always respect people's rational capacity for self-determination. And although physicians and healthcare professionals have a duty to follow the principle of beneficence, unlike the duty of non-maleficence, there is no mention of truth-telling or disclosure or informed consent in the Hippocratic Oath until 1980. Today, however, at least ideally, physicians do value truth-telling. They value the principle of autonomy. Yet in practice, issues concerning truth-telling and confidentiality remain throughout the practice of medicine. Number 9, what is the primary moral question concerning confidentiality in medical ethics? So given that we have a conflict between autonomy and beneficence, two important moral standards, particularly in medicine, we have to ask, is it ever morally permissible for a physician or healthcare professional to lie to a patient? And consequently, we would have follow-up questions like, in what kinds of cases is it permissible to lie? What are the criteria for paternalism in cases of patient confidentiality and right to privacy? This leads us to number 8. Is the duty of confidentiality absolute? There are both consequentialist and non-consequentialist arguments for keeping patient information confidential. One consequentialist argument is that unless patients can trust physicians, they'll be afraid to reveal personal information. And this would then impede a physician or healthcare professional's ability to follow not only the principle of autonomy, but the principle of beneficence as well. It would be very hard to care for patients when they're not willing to tell you all of the relevant information because they don't trust you. Another consequentialist argument is that a lack of privacy, a failure to keep patient information confidential, can expose patients in some situations to discrimination, shame, or ridicule. And we see this in Carlos's case, which is discussed on page 150 of your textbook. There are also non-consequentialist arguments for confidentiality. First of all, the principle of autonomy states simply that we have a duty to respect other persons. The humanity formulation of the categorical imperative states that we should always treat others as ends in themselves and never treat them as a mere means. This requires us to keep patient information confidential. Furthermore, the physician-patient relationship is based on the physician's implicit promise, as we said, as part of the Hippocratic Oath, to respect a patient's privacy and maintain confidentiality. Yet, it's not clear that the standard of confidentiality is absolute. We find one example in the Tarasov case. In Tarasov v. Regents of the University of California, The judge ruled that the protective privilege ends where the public peril begins. So we have the case of a California university student who tells his therapist that he's going to kill, I think it was his girlfriend, Tatiana Tarasov, when she returned from overseas. The therapist broke confidentiality, alerted the police. The police talked to Potter, the student, and deemed that he was not a threat. But sure enough, when Tatiana Tarasov returned to the country, Potter kills her. And Tatiana Tarasov's parents sued the therapist for not disclosing to them that she was in danger. So this case sets precedents, along with a few other cases, showing that although physicians and healthcare professionals have a duty to keep information confidential, there are cases, particularly when there's a risk of harm to others, where confidentiality should be broken. So we might see this in cases where there's a crime or abuse, or HIV cases where disclosure is important to keep others from being infected. Number 7, what concerns are there with confidentiality in technology? So beyond the duty of healthcare professionals, there are other concerns about confidentiality. Our healthcare system is now structured in such a way that people's records and private information are stored on servers, and the software that medical institutions use allow for many different people to be viewing a patient's information, from administrators to office staff to physicians to residents to nurses and so on. It's not really confidential information in the sense that it's shared privately between a patient and one or two healthcare practitioners. That's just not how it works anymore. So we do have concerns about how the technological advances in medicine and record keeping are affecting a patient's confidentiality. Number 6, generally, how does Kantian theory help guide us on questions of confidentiality? Well, there's a pretty unambiguous duty to respect personhood in Kantian theory. And the principle of autonomy for Kant is absolute. There are no exceptions. It's not overridden by beneficence. It's not overridden by any set of outcomes. In fact, for Kant, there are no exceptions. Even in extraordinary circumstances, consequences carry no weight. So even in cases where there might be harm to others, Kantian theory is going to guide us to absolutely respect a patient's confidentiality and right to privacy. Number 5, generally, how might act utilitarians guide us? Well, remember, an act utilitarian is going to follow the greatest happiness principle and decide for each specific action what the best outcome is for everyone involved. So an act utilitarian would take the question of confidentiality on a case-by-case basis. There wouldn't be any overarching or general sort of rule we would get other than follow the greatest happiness principle. Weigh the risks involved, weigh the possible benefits, and make the choice that results in the greatest good for the greatest number. Generally, how might rule utilitarians guide us on questions of confidentiality and right to privacy? So, like the act utilitarian, the rule utilitarian is going to say, well, follow the greatest happiness principle. But the rule utilitarian is not going to apply this principle to individual cases. The rule utilitarian is going to ask, what rule should we put in place such that if physicians followed that rule, it would result in the greatest good for the greatest number of people involved over time? As far as telling the truth, the utilitarians might say, it's important to tell the truth. We saw the consequentialist argument a few moments ago that telling the truth to patients results in greater trust among patients and physicians and allows physicians to better meet the principle of beneficence. So it helps to foster trust in the long run. And same with confidentiality. Following the rule of keeping a patient's information confidential builds trust between patients and physicians. Number 3. Generally, how might a virtue theorist guide us? Virtue theory suggests that if you're a physician or a nurse or a healthcare practitioner of any kind, you would be a good physician or a good nurse if you cultivate virtues like honesty and fidelity and compassion. So virtue theory would say, be a compassionate person, be an honest person, be a trustworthy person, and do the things that honest, compassionate, trustworthy people do. But remember, for virtue ethics, you have to do these things, you have to perform these actions at just the right time, in just the right amount, with just the right people, in just the right way. So it can be really hard to develop good virtues, and there may not be any easy answers in specific situations, but generally, virtue ethics will guide us to become virtuous physicians, to become virtuous nurses, to become virtuous CNAs, to become virtuous dietitians, to become virtuous therapists, and so on. The number 2 thing you should know about Chapter 4 is Case 2. You should understand what's important and what's at stake in Case 2. Case 2, HIV and a Researcher's Duty to Warn, discusses the situation of John, who does research on persons with HIV. And you should understand what's at stake here. The central issue is whether or not John has an absolute moral obligation and moral responsibility to keep his patients' diagnoses confidential, or whether that conflicts with the standard of beneficence and whether he has a duty or an obligation to warn others of possible harm based on his patient's diagnosis of HIV. So you should know which principles are in conflict here, the principles of autonomy and beneficence, and you should be able to come up with an argument about how John might solve this moral dilemma and why his actions would be justified. The number 1 thing you should know about Chapter 4 is what is important about Case 3. Case 3 is concerned with the emergency department dilemma. In this case, you should be able to understand the issues and come up with an argument about what is morally permissible or morally obligated, perhaps, for the ER doctor in this particular situation. Is he required to maintain confidentiality about the patient's blood alcohol level? Is he required to contact the police? And again, what are the morally relevant principles and standards at play here, and how are they conflicting? And ultimately, how do we want to decide what is morally right in this case? Woohoo! We made it! Pretty straightforward chapter on confidentiality. In the next set of readings, we will dig into some of the more detailed arguments.